Hello, Mathijs. You have recently published a paper on vascular access in older patients receiving hemodialysis. Can you tell us more about this?
Yes, of course. This paper concerned the catheter-related infections and malfunctions in older patients compared with younger patients using all central venous catheter subtypes.
Oh, I thought that all patients were advised to receive a fistula when they undergo hemodialysis.
That's right. However, for elderly patients, the surgery might be too burdensome. Sometimes suitable vessels might be lacking, or the development of the fistula fails. In other words, sometimes catheters are unavoidable. Our hypothesis was that older patients, however, have a higher risk of catheter-related complications, and therefore we have compared them with younger patients. We used data of the Ducato study. This was an observational study in 12 Dutch centers in which we included all hemodialysis patients with a central venous catheter. In the current analyses, we have compared the occurrence rate of catheter-related infections, catheter malfunctions, and the removal of the catheter between patients younger than 70 years old with patients of 70 years or older.
Nice. And what were the results?
We included almost 1,600 patients with approximately 2,300 catheters. The occurrence of infectious complications and malfunction events were rather similar between the elderly patients and the younger patients. Also, if we adjusted for potential factors that might distort the association, such as sex and comorbidities, no differences were identified between the younger and the elderly patients. In fact, we found a slightly lower complication risk in the older patients.
It is very interesting that the elderly patients are comparable or perhaps are doing even better.
Exactly. Older patients are often regarded as more prone for infectious and thrombotic complications in general. However, this might be influenced by less physical activity for the elderly or decreased transpiration. Our study emphasizes that perhaps catheters for older patients are not as complication prone as traditionally thought.
Thanks for explaining, Mathijs.
You're welcome, and see you for our next study.
Created using Powtoon.